Imagine this. You're running through a forest, barefoot, no path, no light. You slip, your leg snaps, no hospital, no painkillers, no phone to call anyone. Now what? For 99% of human history, this was just Tuesday. People broke bones, got gashed open, fractured skulls, and somehow, a surprising number of them survived. Not by luck, by knowledge. In 2022, researchers found a skeleton in a cave in Borneo. A young person, roughly 30,000 years ago, had their lower leg amputated. Cleanly, surgically. And here's the wild part. They survived for years afterward. No hospital, no antibiotics, no surgical steel. So how did they do it? That's exactly what we're going to figure out today. Before we had medicine cabinets, we had forests. And here's something most people don't realize. Ancient humans weren't guessing which plants to use. They had thousands of years of trial and error, passed down like a living encyclopedia that existed entirely in human memory. Yarrow, a small white wildflower you've probably walked past without noticing, was one of the most important wound treatments in prehistoric medicine. It stops bleeding almost on contact. We found it in burial sites across multiple continents. People weren't burying it by accident. Then there was willow bark. Chew it, and it releases a compound called salicylic acid, the exact same molecule that modern aspirin is built from. Ancient humans were managing pain with the chemical precursor to one of the most used drugs in the world today. For wounds specifically, honey was remarkable. It's naturally antibacterial. It draws moisture out of bacteria, essentially dehydrating them. In a world without antiseptics, applying honey to a cut wasn't a folk remedy. It was genuinely smart chemistry. Broken bones are one of the most common injuries in any physically active life. And prehistoric life was extremely physically active. So what did you do when a bone broke? Archaeological evidence shows something fascinating. Bones that were clearly broken and then healed properly. Not healed crooked, not healed badly, healed in alignment, which means someone set that bone correctly, held it in place, and cared for the person while it recovered. Some sites show evidence of clay casts, essentially the prehistoric version of a plaster cast. You pack wet clay around a broken limb, it hardens, and the bone is immobilized while it fuses. Indigenous communities in Australia were still using this technique when European colonists arrived, and they likely had been doing it for tens of thousands of years. The recovery period for a broken leg is roughly 6 to 8 weeks. For ancient humans who needed to hunt and move to survive, this meant the community had to carry that person, feed them, protect them, for nearly 2 months. That tells us something profound. Ancient medicine wasn't just technical, it was social. You couldn't survive an injury alone. You survived because your group kept you alive while you healed. Let's go back to that skeleton in Borneo. The individual was young, most likely a teenager or young adult. Their left lower leg had been removed, not by an animal attack, not by trauma. The cut was clean, deliberate, and precise, and the bone around the cut showed new growth, meaning the person lived with that amputation for years. Think about what that required. First, someone had to cut through soft tissue and bone, without modern steel, without sterile instruments. They likely used obsidian or flint tools, which can actually be sharper than surgical steel at a microscopic level. Surgeons today sometimes still use obsidian scalpels for certain delicate procedures. Second, they had to control the bleeding. Tourniquet-style compression using bark, plant fibers, or animal hide could stop blood loss long enough to close the wound. Third, and most critically, they had to prevent infection in a tropical environment, one of the most bacteria-rich places on Earth. Researchers believe antiseptic plant compounds were applied directly to the wound, possibly as a paste, a poultice, or even chewed plant material pressed into the site. And then, someone had to care for this person, bring them food, keep them safe, help them adapt to life with one leg in a world where mobility meant survival. The fact that this person survived tells us that prehistoric surgery wasn't just possible, it was, in some cases, successful. Okay, this one is genuinely mind-bending. At a burial site in France dating back to around 6,500 BCE, researchers found 120 skulls. 40 of them had holes drilled into them, not from violence, not from accidents, from a surgical procedure called trepanation, the intentional drilling or scraping of a hole into the skull. And here's the part that makes this extraordinary. Many of those skulls showed bone regrowth around the holes. These people survived. Some had multiple trepanation procedures during their lifetime. Why would you drill a hole in someone's skull? The leading theories include relieving pressure from head injuries. Every prehistoric society we've studied, there was a designated healer, called a shaman, a medicine man, a witch doctor. The titles vary, but the role was consistent. This was the person who carried the tribe's medical knowledge. They knew which plants treated which injuries. They knew how to set bones. They knew the procedures, the dosages, the timing. And crucially, this knowledge was their entire life's work. They didn't hunt. They didn't farm as much. Their job was to memorize and preserve the medical system of their community, passed down orally, generation to generation, for thousands of years. Women also played a critical role here. Evidence suggests women were largely responsible for day-to-day medical care within family units, tending wounds, managing childbirth, treating illness. The shaman handled the big cases, women handled the everyday ones. The next time you get stitches, or take an aspirin, or watch a surgeon operate, remember that none of that came from nowhere. It came from 300,000 years of humans watching, experimenting, failing, learning, and passing that knowledge on.